All right, well, let's go ahead and begin. Well, good morning from Washington, D.C. I'd like to thank each of you for joining our important conversation today. Before we begin, we wanted to take a brief moment to recognize the sponsors of our side event, Procter & Gamble, USAID, and Biorad for their financial commitment to this year's Water and Health Conference. Without their generous support, it'd be much more difficult to have these opportunities for international learning and for dialogue. Next slide. The title of today's session is Breaking the Policy Barrier, Examining Water Inequalities and Vulnerabilities in High-Income Countries. My name is Christopher Lindsay, and I serve as Vice President of Government Relations for the International Association of Plumbing and Mechanical Officials, or IAPMO. IAPMO is a nearly 100-year-old trade association that's an important voice for the water and sanitation sector, representing skilled professionals, regulators, manufacturers, etc. Today's discussion is really a continuation of a dialogue that a number of the convening organizations began last year. I would be amiss if I didn't express my appreciation and immense gratitude for each of these organizations for their assistance in planning today's session, and for their expertise that they continue to bring every day on this topic. The convening organizations you can see on the slide, or their logos are there. They include Fort Lewis College, Loma University, University of Alabama, University of California, Merced, University of California, San Diego, University of Twente, WaterAid, and WaterAid Canada. And we'll be fortunate to hear from many of our colleagues from each of these institutions in today's main session and in the breakout rooms. Next slide. Just to give you a quick overview of our presentation today, immediately following our introduction, we'll have a chance to hear from 4 distinguished panelists who are representing different voices from across the globe, and from representing remote native populations to unhoused populations in urban centers. So we're very excited for the content that it brings. Following each of these panelists' presentations, we'll have an opportunity to move into breakout rooms where we'll be able to go into a deep dive into various themes. And we encourage you to participate actively in those breakout sessions. And then immediately following those breakouts, we'll be able to convene back here as a main group for final concluding remarks. One of the key things that we did last year and we're looking to continue this year is that this session really continues a dialogue that's taking place between many of our organizations. And we encourage you to be a part of this process. You'll see here there's a Google form where you can fill out, and the link has been provided. We encourage you to get on to be able to fill in your contact information, and we'll keep you apprised as the call to actions from this session are developed, and we continue to move those forward. And we'll be able to put a reminder of this at the end of our session as well. Just taking a moment to set the scene for our discussion today. Millions of people living in high-income countries lack access to clean water and to safely managed sanitation and hygiene facilities. I think many of us who just came from the plenary session had an opportunity to hear some of those experiences already this morning. As we saw, these inequalities are frequently the result of biased and flawed policies and practices that either disproportionately impact minority and low-income communities or have been explicitly designed to marginalize them. Unfortunately, the institutions that will play an important role in ultimately delivering social justice and universal access to these historically marginalized communities are often the same ones who have perpetuated the disparities in the past. Today, we've convened a panel of stakeholders from Europe, North America, and the Pacific to provide a portrait of WASH access in high-income countries through a policy lens. Our focus today will be to discuss historical contexts that have contributed to current inequalities, highlight the current state of play of policies and programs that are both improving and limiting access to WASH services, and outline steps that should be taken to improve the policy and funding landscape in a way that will increase the flow of clean drinking water, hygiene, and sanitation services to all those who have been left behind. With that, I'm going to turn the podium over to Colleen Naughton from the University of California, Merced.
Yeah, thank you so much, Christopher, and thank you for all your leadership of this side session. So just really quickly, we are building off of last year's side session focused on high-income countries and reaching those left behind. And we co-authored a practical paper in the Journal of Water, Sanitation, and Hygiene for Development. And so many of the co-authors are involved in planning this session. Katie Matos, Riley, Carmen, Joe Brown, and Clarissa Brocklehurst and others. So please take a look at that. So one of the main outcomes or recommendations was to restructure national, regional, state, and local law and policy. So we decided to focus this side session on policy recommendations, but of course, continuing to involve marginalized or underserved communities in decision-making and launch targeted data collection campaigns. But I really would like to get to our panelists and let Christopher take the floor again to introduce them.
Perfect, thank you, Colleen. First, we're going to hear from Adam Asai, who's a visiting Fulbright scholar from Northeastern University School of Law. Adam's going to be sharing with his experience in working with Roma communities in Europe, particularly Slovakia. Next, we'll hear from Sergio Carranza, who is the executive director of Pueblo Unido CDC, which is an organization working in the Eastern Coachella Valley. Following Sergio, we're going to hear from Joanna Avalar, who is a postdoctoral fellow at the University of California, San Diego, who's done some very interesting work on unhoused communities, particularly in the Los Angeles area. And finally, our concluding speaker will be Dr. Nina Lansbury from the University of Queensland, who will be highlighting the Aboriginal communities in Australia. So with that, I will turn the podium over to Adam, and we look forward to your presentation.
Thank you very much, Christopher, for introducing me. So, as mentioned, I'm a visiting Fulbright scholar currently at Northeastern University in Boston. And originally, I am from Slovakia, where I am pursuing a PhD in law at Comenius University. And a part of my research is devoted towards researching and documenting the wash inequalities that in Europe plague particularly communities of Roma people, something that has been outlined even in the plenary by Michal. When talking about Roma communities in Europe, it has to be underlined firstly that while my research focuses mostly on Slovakia, where I pursued the PhD, the issues in disparities in access to water have been documented similarly in many of high-income EU countries, Slovenia, Romania, France, or Sweden. So I do hope that my contribution can bring a little more pan-European insight into the issues. When dealing with the issues that plague the Roma communities, a fundamental thing to note is that most of the Roma communities in Europe face residential and spatial segregation in comparison to the rest of the population. If we could move over to the next slide, please. This is what the residential segregation looks like, particularly in Slovakia. This has been documented situation by Forum for Human Rights, an NGO specializing in protection and strategic litigation of rights for vulnerable groups, including Roma. And if we could skip just to the next slide with the graph, there is ample evidence that suggests that these segregated communities are much far worse off compared to the communities of Roma that are integrated within the majority of the population. However, not many of the Roma are integrated. All too often, communities are either segregated on the outskirts of municipalities or are actually segregated either through man-made or nature obstacles, such as railways, roads, or even rivers. We have Roma communities even living on islands in the midst of rivers that face floodings regularly once the river levels rise and their homes are regularly flooded. When assessing the situation in terms of access to water and sanitation, the established data in Slovakia show that out of approximately 1,000 Roma settlements or marginalized Roma communities, as the Slovak policy calls them. Out of those 1,000 communities, approximately 200 of them is left with no lines at all. And out of those 200 communities, at least 50 of them use what is called substandard water sources altogether, meaning not only they do not have access to tap water, they do not even have private wells or public wells in the open space of the settlement, and they do not have even any source of a public water pump. And the worst cases are documented on the next slide, where Roma people have been often using simply water that is out in the open, that is often used even by wild animals. And in some cases, although I do not have a photo here, water that is explicitly marked by signs as not safe for drinking. Nevertheless, it is virtually the only source of water that the Roma in the vicinity have. So in fact, they are forced to use it as there is simply no other source of water for them available at all. When examining these inequalities through the policy lens, there are, if we could move over to the final slide, there are several reasons why the both historical and current policy perpetuates and even worsens the situation of Roma communities. First being the historical, where Roma communities for centuries have formed these settlements on lands that they do not own. And in Slovakia, this issue has exacerbating, at least since the post-World War period, where the Roma communities often built multi-generation households on land that they do not own, because obviously they cannot afford to buy it. And they have de facto permanent residence, which obviously worsens the capacity of municipalities to build the infrastructure because they require the consent of actual owners that often refuse to agree. Then the proposed solution by the government and the EU has been to develop funding, but often these municipalities lack interest in the funding. And when they do actually secure funding, they often, in fact, do not do so in order to construct large infrastructural projects, but rather small-scale projects that are easier to apply for, easier to construct. What has been dubbed the water vending machines, which is essentially a machine out in the open where Roma can pay in cash or through cards to get the water, but often at prohibitive costs. Which brings us to the final policy, which is that even though the current recognized problem is the lack of infrastructure, and so far there are efforts to improve the infrastructure, the result that is still not being addressed is actually the socioeconomic situation of the Roma. And the question that even if they eventually get the necessary infrastructure, often they are disconnected from the water supply because they in fact cannot afford it either way. So the final component of affordable water, even if we surpass the accessibility and availability of water, actually, the affordability remains a problem that is not tackled among these communities, which is something the state should consider in the future. So thank you for the time I was given to present this outline of issues in Europe. And I will now move the word over to Sergio.
Sorry. My name is Sergio Carranza. I was saying we provide service and technical assistance to communities living in the Eastern Coachella Valley, California, in the United States. They are mainly farm workers, immigrants coming from Mexico and Central America. One of the things that we actually has found is that these families, due to the lack of affordable housing, they started to create informal cooperatives and created spaces where they can live, most specifically mobile home parks. So the communities that we provide service are mobile families living in mobile home parks. And these families has been a remarkable example of alternative solutions for not only affordable housing, but for infrastructure in the Eastern Coachella Valley. Just to put in context, farm workers contribute to over $600 million in the local and regional economy in the Eastern Coachella Valley. It's still considered the most largest disenfranchised community. The poverty level still remains at 35%. And as I explained just a few minutes ago, the pervasive issues that we have is the lack of infrastructure and affordable housing conditions. So what other conditions that are related to these issues are the lack of a community economic development opportunities. So the next slide, I will talk a little bit about what is it that these communities do. Again, this picture that you see there are families who are being able to actually provide affordable housing. They are family-owned communities, and they represent about 25% of the available affordable housing living in mobile home parks. Typical example is that mobile homes are not permanent, stick building units. They are just set on piers. And one of the issues that they have is great levels of, in the case of water contamination with arsenic and fluoride. The next, slide, basically what we have done to overcome this lack of representation, mostly political representation, is that we provide technical assistance and we organize the communities to have a greater voice. A typical example is through community engagement, a lot of interaction with local government, with the state government officials. We present, opportunities for potential, changes and policy. But at the same time, all these priorities, which is important in addressing the lack of drinking water and sanitation, is that it is important to learn from the community. Community organizing is fundamental, is the cornerstone of actually creating a map so that we can continue actually having better opportunities and investment into these farm workers communities. The next slide is just present an alternative solution. We have found out that basically when we try to bring a critical infrastructure using a municipal approach, it takes years. One example is that sanitation projects done in one particular community, it took between 7 and 9 years. So communities cannot afford to be waiting for a long period of time to get access to drinking water. So one of the solutions that we came out was to start other innovative ways through using, innovative technologies, which is, in this case, interim solutions for drinking water, implementing the point of use water filtrations under the sink. The picture that you see this under these children represent the sink, and underneath the sink you have a unit that produces 15 gallons per day. And we have done this through a combination of government funding, but the private sector has become also a key important, player and expediting and making things more streamlined and easy to implement. So once again, what we're looking here to these communities is this. In conclusion, we need to listen first what the community priorities are. And based on those priorities, we need to create a platform, a plan, a strategy to start organizing and provoking change so that families have voice and representation with the local government programs. Knowing that these programs takes years for implementations, because we are talking about multi-million-dollar investment, and when it comes to drinking water and municipal sanitation, we also need to implement other alternative solutions, interim solutions, so we can actually provide those resources to the community and continue to actually find other more public policy solutions to get this investment in a more streamlined process. And with that, I conclude my presentation, and I give the next presentation to my colleague. I think it's
Joanna.
Joanna. Thank you. Thank you so much, Joanna.
Hi, everyone. Good morning, good afternoon, good evening, depending where you are in the world. I'm Joanna Avalar, and I'm a postdoc fellow at UC San Diego. And today I'll be presenting to you my dissertation project when I was at USC that focuses on wash insecurity experience among unhoused communities in Los Angeles. Next slide, please. So when we think of wash insecurity, we rarely think of this being an experience in high-income countries. And this is because oftentimes in global water reports, the US claims that there's universal access. Next slide, please. And so in LA, specifically taking the example of unhoused communities, we are being confronted with a homelessness crisis, and we have one of the highest homeless counts in the state. And roughly, Los Angeles Homeless Services Authority estimates that there's roughly 66,000 people who are unhoused, meaning that they're living in shelters, that are living in tents, makeshifts, or vehicles. And this population is overrepresented by people who identify as Black or Latinx. Next slide, please. And so what I wanted to investigate in this project was looking at how wash insecurity impacts the community who doesn't have a fixed shelter. And at the cross-sectional level with my research team, we interviewed 263 people who identify as experiencing homelessness or that are unhoused in LA. And in the map on the right, it shows black dots are the people that we sample in the community of Skid Row in downtown LA and outside those communities, including the beach areas. And we use a mixture of convenience and snowball sampling. Next slide, please. And in interviewing this population with lived experience, we found demographically in our sample that it's similar to those point-in-time estimates that the county provides, that is predominantly Black and Latinx, male population with an average of 48 years old, and a median of 5 years of being stably housed. Next slide, please. In thinking of WASH accessibility, we asked the participants their access and the different sources they use. And for drinking water, 77% of the participants reported that they have at least basic drinking access. And what this means is that they walk less than 30 minutes to access their water source. And they heavily rely on bottled water that they get from donations or that they have to purchase at supermarkets or from public facilities, including restrooms or water fountains found in libraries or in parks. And 6% do reported that they illegally tap into fire hydrants to obtain drinking water. 11% of that sample reported limited access to drinking water, and what this means is that they walk more than 30 minutes to access drinking water. At nighttime, though, that landscape of accessibility for drinking water completely changes, with 50% of our sample reporting that they use stored water at night due to reduced hours of operation of the sources they use during the day and safety reasons. Next slide, please. Now, sanitation access throughout across the time of day, it's reduced heavily. In this bar, what I want to highlight, if you can click next, please. In the morning, afternoon, there is limited shared access to public restrooms. Next, please. As you can see in the image on the right. But at nighttime, we see that that's heavily reduced, and that forces people to embark on other survival mechanisms, including using buckets inside their tents or embarking on open defecation. If you can click next, please. And it also forces a small sample of the population reported that even hold from going to the restroom at night because of safety reasons. If you can click next, you'll see the images of people that illegally open gates within freeway passes to dispose waste or use open defecation. In the next image, you'll see buckets inside the tents that predominantly a lot of the sample population had when we interview them. In the next slide, please. In terms of hygiene access, and this is even looking beyond just hand washing, we try to measure shower and laundry accessibility. And for hand washing, at least 33% of the participants reported hand washing using soap and hand sanitizer. And they predominantly rely on nonprofit organizations or public restrooms. Now, for shower access, 73% of the participants that we sample shower less than 3 times per week. And this is because there's a lack or a limited accessibility to showers in the communities of downtown LA and Skid Row. For laundry, this is even much worse, with 81% of participants reporting that they're able to wash their clothes less than 3 times per month. And again, it's a heavy reliance on nonprofits that are trying to fill in the gaps of services. If you click on the next slide, please. Now, there are programs, as I mentioned earlier, that are addressing washing security in Los Angeles. Specifically, there are city-funded programs like Pit Stops, if you can see in that image, or the Refresh Spot, which is one of 2 of the 24-hour available services in Skid Row alone, which is very limited. There's shelter systems filling in the gaps, but predominantly nonprofits are doing the heavy lifting, as you can see in the image with the mobile shower and restroom. Next slide, please. There are also programs that are reinforcing that cycle of poverty and washing security, and this is through the criminalization of homelessness that's enforced through encampment sweeps, as you can see in that image, with sanitation workers continually displacing unhoused communities. And what this does is that it disrupts the connection between service providers who are providing services to those encampment communities and the population that's being displaced. And so thinking of policy, on the next slide, please, we need to focus on washing security beyond the household, right? We need to, as Sergio mentioned, as Adam, that there needs to be an investment in infrastructure. And although this can be really expensive, encampment sweeps are even much more expensive. And so we need to invest on redesigning services and involving the community in that design process, because there needs to be an increase in women-only services, a high-risk population, elderly, and people coping with disabilities, and also increased access to undocumented, unhoused communities that do not qualify for a lot of the federally funded programs that are available. And ideally, changing that cultural perception that increasing access to wash would sustain or enable homelessness, which is not the case. And with that, I want to end the presentation with thanking, in the next slide, this wonderful group of people that helped with this project. Thank you. And I will pass it on to Nina.
Good morning. Thank you for the opportunity to talk to the conference today, and I apologise I'm not speaking to you live. It's just past midnight in Australia, where I live in Brisbane. So I really appreciate that the conference has this session, because I think often when we talk about WASH issues, we do forget different minority communities and different locations, such as rural and remote, who are challenged in high-income countries with WASH issues. And as I am sitting here in Australia. I am sitting here on Aboriginal country. This is traditional lands of the Jagera and Turrbal people here in the land now known as Brisbane, and I pay my respects to elders past, present and emerging. I've been challenged to speak to you for a few minutes and to these three topics on the screen. So I'm going to talk to you about the issue of water and sanitation in remote Indigenous communities in Australia. There's a range of challenges, but there's also some really clear pathways towards positive change. So firstly, let's talk about history. Let's say it up front. We are in a colonised country, a settler colony of Australia, and the Indigenous peoples of Australia, the Aboriginal people and Torres Strait Islander people have been here for thousands of generations. And the population in combination is about 3% of the population. Only 1/5 live in remote and very remote communities. It's also a diversity of peoples. So we have perhaps 350 different language groups on the mainland, and now up in the Torres Strait, around 5 different language groups. But if we do just focus on the 1/5 of the Indigenous population who live in remote communities, and you can see on screen, it's a whole range of different climatic conditions and geographies and peoples and language groups, and living in communities between around 50 and 3,500 peoples. And what we do know, unfortunately, why is there a disproportionate burden of disease in our Indigenous population in Australia? And we've got to say racism, we've got to say colonisation, because there's long-held and generational impacts. The social determinants of health can explain many of these inequalities and inequities as well. But we do know from our statistics, and now I'm heading into a deficit discourse, that Indigenous peoples in general have a lower health status and higher burden of disease than the rest of the Australian population. And as you go more remote and more rural, the burden of disease just increases. And so you can see here a quote about insufficient access to clean water and sewage system remain contributing factors to preventable conditions, skin infections, eye infections, diarrheal illness, especially with children. So why is this the case? And there's a range of policies over time that have been inconsistent, that have been discriminatory, that have been insufficient, and funding has been ad hoc and insufficient. So if we just think about water and sanitation in these remote communities, we have issues of palatability, where it's actually not nice, and because it smells funny, tastes funny, looks funny, and so there might be a movement towards other drink options that are much more palatable. And there's a very high level of soft drink or sugar-sweetened beverage consumption, which brings other challenges: obesity, diabetes, oral health care. It's really hard to monitor water and get those samples to an independent lab for testing on a regular basis. There's a whole range of reasons for different sources of water and how they are contaminated microbially, but also naturally occurring chemicals at very high rates, such as uranium, arsenic. And if we think about sanitation challenges, that the kit, the technology that's being installed, is not necessarily appropriate for people, place and purpose. And so it can be very high tech, might be reverse osmosis, but it might not be appropriate for that source water, for the operator's skills, for the support that's coming from the head office. And so the range of issues we're looking at, we do still have some areas that are allowing self-certification by the installer, so that can lead to problematic installation. There can be issues around what's being flushed down the toilet and leading to blockages, but very slow repair because of these communities being perhaps 800 kilometres from where the plumbing centre is. But let's talk positive, and there are a range of issues, and I have what I call the 5 enablers that I've published about. They might seem very simple to this audience, but actually they've been quite breakthrough when I've talked to the water industry and to government bodies. So firstly, number 1, I've got 5. Number 1, think about the people. Are they well supported? These water operators who are in remote communities, is their technology that they're operating actually the same as what they trained on? And are they experiencing a culturally safe environment, or is there actually some racism there as well? Number two, look at all the different agencies that are responsible, and are they allowed to interact with each other so you get that benefit of cross collaboration? I've got some examples on screen of where it is happening. You've got the water agency talking to the housing agency, talking to the Indigenous peoples agency, and talking to the infrastructure agency. And when they all work together, you actually get efficiency, you get support for all those different dimensions. Number three, technology needs to be fit for place, fit for purpose, and fit for people. And sometimes the most sophisticated kit is not the appropriate for the location. Sometimes a lower technology option can be the better option. It can be easy to fix, and it can also be appropriate for the level of training and understanding. You can see on screen what used to be in location here, what's there now. You actually have a backup pump, and you have it appropriate and safe for the water operator who's, so it's safe, but it's also quite low tech and able to be handled by operators. Number four, money. In Australia, we have a range of states and territories. It's a very mosaic type arrangement. And in the state where I'm talking to you from, Queensland, we have Indigenous councils for 16 areas that are different to local government and have different funding structures. And it can mean that local Indigenous councils required to manage water and sanitation under the Public Health Act, but not funded in a regular way, funded through grants. Very unsustainable, very inconsistent. So we need adequate funding with the proper timeline and the proper volume of funding. Finally, number five, let's think about it in a system. Water and sanitation can't be viewed in isolation. This image here is of a fantastic pond that was built for protection of treated water on a remote island in the Torres Strait. What was not considered was that there were migratory birds, huge flocks of them at nearby islands, who now prefer to live here on top of this covered reservoir. Instead, you've got really high E. coli contamination. This water was treated and now needs to be treated again. So you've got a public health challenge here. And that's because we need to think of this as a system. Everything is interlinked, and we need to be able to anticipate what issues are going to be problems in the future and how to protect against them. So I want to conclude with words that are not mine, but actually from on-ground engagement that I've conducted. Got two quotes here. The first from a water utility. We've got to understand in this settler colony of Australia, if people want to live on traditional country, that is their right and that needs to be supported, and access to water is a human right under the United Nations. And so that's the starting point, is people living on remote and in traditional country. How do we ensure that they have safe water to drink and that their fecal and other waste matter is contained and separated from contamination risks? Secondly, let's remember we're in the era of the Sustainable Development Goals. Australia is one of 197 signatories. I'm sitting here in 2021 in Australia, and yet not everybody can turn on the tap and drink a safe glass of water. Some slides will be made available, and I would love to be in touch with you if you're working on similar issues. Thank you very much.
All right, thank you so much to all of our speakers for setting that context for the next section of our side session, which will be our breakout rooms. So we wanted to have a really action-oriented approach to this topic. So we're hoping to put together a call to action as an outcome from this session. We are hoping for each breakout room to come up with several 3 to 5 calls to action that are explicit actions that policymakers in high-income countries can take to finally achieve this universal access to water and sanitation services in high-income countries. So we'll be focusing on that for our breakout room. We do have a Google form here. The link is in the chat on the conference platform, and we'd appreciate if everybody can fill that out so that we can follow up with you to disseminate this call for action so that you have the opportunity to disseminate it yourselves to leaders in your own country. I'll go to the next slide. So we have 4 different breakout rooms. In the first one, encouraging industry and private sector involvement. Number 2, ensuring adequate data collection. Number 3, thinking about funding systems. And number 4, accepting the human right to water and sanitation. So the focus of the breakout room will be to dive deeper into the policies and challenges discussed by the speakers just now, but also in the morning session, which I hope many of you were able to attend, the plenary discussing high-income country challenges as well. And specifically, we'd like to focus on policies and programs that can be expanded upon or changed, and models that are working and examples of success. So next slide, please. Please go ahead back to the conference platform. You'll leave this meeting and go to the UNC live platform and click on the breakout room and join from there. We'll come back to this session at 1:45. So I believe that's 11:45 Eastern time, about 20 minutes in the breakout rooms. We'll have somebody here to answer questions if anybody's having trouble accessing those breakout rooms. Verbal conversation and the chat today, and really just for being part of this conversation. So to me, working with a lot of different historically marginalized populations in the United States, I just see these conversations about WASH in high income countries as so critical to helping the global WASH conversation. And one of the things that strikes me often is that in high income countries, we're dealing with these last mile populations, this highest hanging fruit. And if we are all going to achieve 100% coverage of water and sanitation for all, then every country in the world will hit this point where we are trying to reach that highest hanging fruit, where we are trying to reach the most vulnerable, the most challenging, the most, historically marginalized populations with water and sanitation access. And so I think we can have a lot of conversations in high income countries where we're both learning from the national or the international conversation, and where we can contribute to that international conversation. So just to highlight a couple of things that the speakers said today, I think that Adam McCall gave a really interesting point about some of the infrastructure that we're doing is easy, but expensive for users. And he gave the example of water vending machines. And I think that there is a component of infrastructure and funding and affordability there that needs to be considered in this conversation. Sergio Carranza made the point that the municipal approach just takes way too long. We really need all hands on deck to try to achieve WASH for these final few percent or final portions of percent that need access in high income countries. He gave the example of 7 to 9 years. And that's exactly as long as we have to meet SDG 6. So that's not very much time, as we all know, when these processes take so long. We need to find ways to speed those up. Joanna Avalar specifically talked about the needs of vulnerable groups, right? So specifically thinking about women and disabled population and historically marginalized communities and people who really need additional help and specific focus to be reached. And Nina Lansbury made the point that we are working on systems, not just in isolation. So we need to consider water, sanitation, and hygiene together, but also in the context of our larger communities, of housing challenges, of justice and anti-discrimination, anti-racism, and correcting historical wrongs that we've seen in our countries. So thank you so much to the plenary speakers, and thank you again to everybody here who contributed to the breakout groups. I hope that we have some final takeaways. I don't know if we can pull up the final takeaway slide yet. Thank you so much, Colleen. So I'll start
the private
here.
sector is missing. Yeah.
Okay, no problem.
I added it to the wrong slide. Sorry, guys.
No problem. Christopher, do you just want to go ahead and state a couple of your breakouts from your group, please?
Sure, just a couple at very high level. We felt that industry should, private sector had a greater role to play in drawing public attention and political will to the situation, and that policymakers and industry policymakers should take better advantage of industry knowledge, research, and resources in the design of programs and bringing them into the conversation with the local communities, because we felt like ultimately for these services to be provided sustainably required industry involvement and engagement.
Great, thank you. Colleen, do you want to talk about yours briefly here?
Yeah, we had a great discussion. We're still synthesizing everything from the Google Doc, but prioritize especially WASH data collection and services in underserved communities, like in rural or like marginalized groups in the Roma communities, like in Europe, or unhoused populations. These populations don't often get a lot of attention, and it's easier to collect data in urban and like well-served areas, and to ensure systematic, quality, equitable, and comparative quantitative as well as qualitative data collection, and increase WASH services and data collection in public non-commercial facilities. So getting to those kind of unhoused populations or informal populations. And April Ballard made a point that it can't just be in like commercial buildings where they may not have access. And I think that hit upon our speaker in LA, from LA as well, that at night they can't access these facilities.
Yeah. Yes, thank you. Jillian, can you give us a summary from the funding group?
Yes. So our first main takeaway was that we want to make sure that the communities are involved when the funds are delegated to them, so the communities can say, this is how we want the money to be spent, instead of how, like the presenters mentioned, the government may just decide what they want for solutions, but making sure that the communities are feeling empowered in those funding uses. And then our second point was also creating the qualifications for certain funding sources in order to improve the accessibility for unhoused people, as well as like individual homeowners, because a lot of the funding mechanisms go to public entities. And then our last point actually got added before we were able to finalize it. And what we were intending for it to be is that we want to make sure that the government are fulfilling their obligations and treaties to the human right to water and fully funding WASH things. So using data to see, okay, the funds really do need to be happening in addition to the treaties and obligations they already agreed on.
Thank you so much. And Georgia, would you like to summarize the human rights calls to action?
Sure. So our group talked a lot about the human right to water and sanitation, and how do we actually reach some of these communities that we've been talking about throughout this session and that were talked about during the plenary. So really, one of the main takeaways was really integrating that human right to WASH into legislation and policy, and also making more people aware of these communities that don't have access to water, sanitation, and hygiene. And then there were a few people that mentioned the importance of holding governments accountable for achieving that human right. And some of that would be through advocacy, through media attention, and then also data collection, and bringing back to sort of recognizing the different populations that don't have access. So acknowledging and finding out where they are, and keeping track of that. And then sort of building on the idea of what are some of the programs and or models that might of successful ways of reaching more people. We talked about technical assistance as being one of those ways of helping, especially rural communities, get some of the resources they might need or training that they might need to bring greater access, and then have that access be sustained over the long term. Thank you.
Thank you so much. So we are closing out right now, but please do check the conference platform chat for a link there to fill out a form, so that you can follow up. We can follow up with you with this call to action. Again, we want this conversation to continue. We know we've just barely touched the tip of the iceberg here. We hope to be at at future UNC conferences building on this topic, and please do contribute as well to those Google documents from your breakout rooms. Thank you to all of our sponsors, and thank you so much to all of our organizers for this event. I hope you all can understand how many people contributed to this, both our speakers, different organizers, our breakout room leads, our note takers. So we really appreciate you all, and we hope you all have a wonderful and productive rest of your conference.
Thank you.
You're welcome. Thank you for coming.
I think I'm the host now, so I will end, but thank you, everyone.
Thanks,
Thank you.
everyone.